Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice, Private Physicians Medical Associates, PPMA, with your host, registered dietitian and nutritionist, Meg Tancredi.
Hi, everybody, and welcome to the Nourish MD podcast, where we learn, grow, and nourish together. I am your host, Meg Tancredi, registered dietitian, and today I am very excited to share. I will be the special guest. In light of this month, March, being National Nutrition Month, I thought we would do things a little bit differently and shine the spotlight directly on nutrition and specifically what a dietitian does, what sessions look like, and kind of common misconceptions and questions that dietitians, myself included, typically come across. So hopefully by the end of this episode today, that you'll have a better understanding of nutrition, what a dietitian does, and how we are here to help. So I wanted to start off by sharing a little bit about how I became a dietitian. Someone was surprised to hear that I haven't been a dietitian my whole life. Long ago, not when the dinosaurs roamed the earth, but long ago, I was an elementary school teacher for about 10 years. And at one point in my career, I started to really notice the effects of nutrition on attention span in kiddos. I taught kindergarten and first grade and third grade. And so I started to just kind of noticed the good, the bad, the ugly when it came to food and nutrition in general with kiddos. And as my interest in nutrition grew, and I at one point in my career, I was able to create a nutrition curriculum for the kids, which was a lot of fun. Took them to the grocery store, talked about what's sustainability and the impact on the environment, all that really fun stuff. And I ended up meeting someone who was a registered dietitian. And I said, I have never heard of that career. Like, what is that? Tell me about it. And so what I gathered at that point was this person got to talk about nutrition and education, and those two went together. And I thought, this sounds amazing. Because I absolutely love education. I think teaching people and seeing people make positive changes, whether they're 8 years old or 80 years old, is one of the most beautiful things ever, which is why I stick around doing what I do. So at one point, I had earned my master's degree in educational psychology from USC. And because I thought, hey, I'm going to go on and change the world of education. But when I got into the classroom, I really noticed how much I loved teaching. Fast forward that time, when I learned about what a registered dietitian was, I had this light bulb idea come on. And I thought, I really enjoyed grad school the first time. I'm going to go back and do it again because I'm an educator in my blood. And so I went back, and USC offered a really amazing program. It's a graduate program with an emphasis in nutrition, health span, and longevity. So I went through that rigorous program in 2 very concise years. And when you want to become a dietitian, not only do you now have to have the graduate degree, but you also need to have a 1,200-hour internship of medical nutrition therapy, community nutrition, nutrition counseling is in there. So we had to do 1,200 hours of supervised internship. We also had to do a capstone research project, of course, and then we have to pass the national registration exam. So all of that was required to become a registered dietitian. If you know me personally, you will hear me defend dietitians all the live long day, because it really was a huge journey to become a dietitian. So I really had to push large boulders up the hill to make it to where I am today. And I'm very proud of that. And I'm happy to talk about that today. So hopefully you're happy to listen to me chat a little bit more about that. So becoming a dietitian was a journey. And of course, we have, continuing education that we need to do every year. which is really important, right? Because not only are we looking at the current science and the techniques and everything involved around nutrition and health in general, we look at physical and we look at mental health. We look at the current trends in science, the current trends in diet, right? So all of that is meant to keep us dietitians up to date with what is going on in the world with health, right? So I wanted to talk a little bit. I've got some notes up here because I was chatting with someone earlier and I was saying, there is so much for me to talk about in the world of nutrition and health that, I could be here for like 5 hours and I don't think that's allowed. So I have some notes just to kind of keep me on track because again, I love what nutrition can do for us physically and mentally. I love the world of health. I think there are so many beautiful things that we can be doing to really feel our best and just optimize health and wellness that, hey, why aren't we doing them? So I love talking about them. It's almost become like a hobby too. I talk about this stuff all the live long day. So I wanted to bring up a couple of examples of common topics that I hear that I've been hearing for as long as I have been a dietitian. Well, and even longer, actually. So, of course, the first one is the weight loss frustration. And oftentimes, I hear a lot of women, but both women and men, can struggle with weight loss and doing it in a very sustainable, healthy, gradual way, which is the way that we want to lose weight. So I do want to talk a little bit about that today, as well as a couple of other topics. So in the world of weight loss, the big black and white thinking is calories in and calories out. And that works when we are in a closed system, and we are not in a closed system. So a very basic approach to losing weight is you need to cut calories. Side note, I actually just had this conversation with somebody who works at a gym, and that was the approach that they took. And I was talking to them about some diet topics and whatnot. And the focus was solely on protein and cutting out all the other calories that, quote, don't matter. And that sort of narrative or perspective really scares me because people do listen to that, right? Because people do want to lose weight and be at a healthy weight and really feel good about themselves. And I understand that 100% because I want people to feel really good. The problem is when we start having that black and white thinking and we're cutting out really important nutrients, we're really hurting ourselves for the long haul. Very easy example. We hear, I think this was in the 70s, eggs are bad for us. Eggs raise cholesterol. So therefore, you should only have egg whites, right? You want to lose weight, cut out the yolk, only have the egg whites, have the egg white omelet. And that might taste perfectly fine to somebody, but man, when I look at that egg and I look at that beautiful bright orange center, you know what I think? I think nutrition. I think choline for brain health. I think B vitamins. I think this is where all the good stuff lives. Why would I get rid of this? And so that's why I'm saying it can be really detrimental that if we are cutting out and we're solely being, focused on just the calories or cutting out the fat or cutting out certain things that our body truly needs, we end up harming ourselves. We might not feel it that day, but maybe we will because we're going to be maybe hungrier and not feeling that satisfaction. So I encourage people to really think about, are you following like the calories in, calories out method? Because it's a bigger conversation than just that. So the basic approach to losing weight, right, is black or white thinking, cutting out the calories. In a session with me or with a dietitian, we're going to explore more than just calories because we know calories are not all equal. So if person A consumes 200 calories and person B has 200 calories, my first question is, what are those calories? Where are they coming from? Right? Are they coming from 3 Oreo cookies? Or are they coming from half an apple, a string cheese, and maybe some pumpkin seeds? I mean, that's like a night and day difference. But again, this is why I don't look at only calories being consumed. So if you've had a session with me, you might know this already, but I'm going to ask you, what is your sleep like? How is your stress load? Are you moving your body? What is your muscle mass like, right? When we hear people say, oh, I lost weight, my first gut reaction in my soul is, I hope that was not muscle mass, right? We do not want to be losing muscle mass. We want to lose fat. Absolutely. We want to see the number on the scale go down. I understand that. But again, my job is to make sure that we are doing it in a very, very healthful and sustainable way where you still feel really good every day, where you still are optimizing other parts of your life and your diet so that you're hitting all those targets. So I'm thinking of, how do we optimize sleep? How do we get that stress down? How do we make sure we do all these things? And that's what's going through my head in that first session with you. So sometimes, going back to the calorie part, when we restrict so much, our body starts to adapt to that, right? So initially we might lose that weight, but it comes back. And so the thought is, well, why is the weight coming back, or why is it plateauing when I've already cut out all these calories, right? And so that's a term called metabolic adaptation, right? Sometimes it's called adaptive thermogenesis. So basically, the body is responding by lowering the metabolic rate and conserving what it has. We can see a reduced conversion in thyroid, like T4 to T3. So our thyroid is not converting as well. Our hunger hormones can be dysregulated. So we see an increase in the hunger hormone called ghrelin that tells us we're hungry. And then there's leptin. We feel we have a decrease in that, which tells us, hey, we're full, we're satisfied, we're good to go. And so those become dysregulated. So all these behind the scenes things are happening when we drastically cut calories and keep them low for a long time with the hope of losing weight. And so I'm not giving you all this information to scare you or to worry you, but more of, I encourage you to think about, is this the approach you've been taking? And maybe we need to explore something else. Maybe there's some other avenues that I can help you with, or that another dietitian can help you with. So you feel better on a day-to-day basis. And you also feel good knowing you are eating well, your portion size are correct, but all the other lifestyle factors that are important that impact metabolic health are being considered. The other example I wanted to bring up, because I have 100 of these, but the other example I wanted to bring up was blood sugar issues. So a lot of people these days, most people, I think the statistic for prediabetes is 1 in 2 or 1 in 3 people have prediabetes. And oftentimes they don't know that. Just for clarification purposes, and because I believe all people should be advocates for their own health and take control and have knowledge of what's going on in their body. What do their labs mean? Why am I on a medication? I think that's really important to know. I think it's important to be in the driver's seat of your health and not just the backseat or passenger seat or even on the roof. So thinking about, okay, if I want to make sure my blood sugar is controlled, or I was told, oh, my A1C is fine, or I have this prediabetes diagnosis, right? We want to know, where is that coming from? Why is it my A1C is whatever that number is, right? So asking questions, learning what it means. I am here to help you. So a lot of times people will come into my office and they'll say, hey, I was told I've got prediabetes or I have blood sugar issues. I need to cut out carbohydrates. So usually the first line of defense, right, is cut carbs. One of the regular responses I hear is I don't eat sugar. I don't eat a lot of sugar. And so, that's a really good starting point. And keeping in mind that there are so many other factors that directly impact blood sugar, not correlation, but causation, that directly impact blood sugar, that we have to consider those if we're serious about improving blood sugar overall, right? For example, most doctors include a hemoglobin A1C in lab work. That's a 3-month average of how your body's handling that blood sugar, right? It's how much glycated hemoglobin do we have in there? So hemoglobin has a rough, 3-month lifespan, which is why we check blood sugar every 3-ish months. Usually it's like 4 to 6 months. So we check that, and it's important to know, okay, my A1C is this. Is there potential for it to go lower? If that's a yes, most people could probably say yes to this answer. And why is that? It's because when we have elevated blood sugar over time, that is causing damage in our blood vessels. And think about the miles and miles of blood vessels in our body and what they're connected to, from your eyes, your brain, down to your toes, right? So thinking about, okay, if I know I can improve my blood sugar, like there's room for improvement here, what are the things I can do? And so going back to the carbohydrate, it's learning about, okay, what does that mean? If someone tells me I need to cut carbs, does that mean, okay, no more bread? Or does that mean no more vegetables? Does that mean no more quinoa, no more rice? What does that mean? Oftentimes we go into that black and white thinking. So that's what we want to avoid. We want to minimize that black and white thinking, because there is room in someone's diet for a treat. If someone said, Meg, you can never have chocolate again, I don't think I could be their friend. I'd be a little upset about that. There is room. However, we want to look at, how do we optimize our diet like 90% of the time? How do we really make that happen? And the way that I like to help someone make that happen is, 1, by collecting information, but 2, looking at what are the really simple, low-hanging fruit steps that we could start. So if you meet with me, there might be 1 or 2 things that we're going to just kind of become more aware of over time, right? Because making changes, especially dietary, especially behavior change, that does not happen overnight. That does not even happen over the course of a month. It takes time. It takes self-reflection. It takes accountability. So all of that, let me just drive myself back to the carbohydrate conversation. So again, we can absolutely look at carbohydrate intake and the type of carbohydrate that you typically have in your diet. But the other things that are driving blood sugar dysregulation, we want to look at, what is your sleep doing? When you don't sleep very well, let's say 5 or 6 hours, which unfortunately is a lot of people these days, 5 or 6 hours is not good. And so we got to figure that part out. But 2, when we don't sleep well, our blood sugar does not respond the way we would like to see it respond to meals that we're used to eating. So people who have worn the continuous glucose monitors can vouch for this, right? So you can eat a meal. We generally see how our blood sugar responds to that. Then you get this poor sleep for whatever reason, and we see the glycemic response, the way that our blood sugar handles that meal. It's not looking too good. It's not looking like our norm. It's worse. So sleep absolutely can help our body better handle whatever's coming our way the next day, including resiliency to stress. Maybe there's a low protein intake. So if our meal, if most of it is carbohydrates and not enough of a protein and healthy fat that actually regulate blood sugar, yeah, we're going to take a look at that. But all of this is a learning process, right? So we're going to learn what carbohydrates are. We're going to learn that the fiber ones are the really important ones, and we don't want to cut those out. We're going to learn about portions, but we're also going to learn about all these other factors like meal timing and how close to bedtime are you eating. We're going to talk about all these factors that do impact blood sugar. So maybe there's just some things that we can tweak or modify. And before you know it, your blood sugar is going to start to improve. And we know that there's both long-term and immediate benefits to regulating blood sugar. So I feel like weight loss and blood sugar, they do go hand in hand. And also, they're two very important, very common topics that I do talk about when I meet with people regularly. And even people who don't have, an A1C of 6 or even, 5.7 prediabetes, that's okay. You should still learn what is impacting blood sugar so we can keep that under control, keep it at a really good level so it doesn't become, higher up later on in life, right? It's actually a lot harder. It's more challenging to turn the ship around after some damage has already begun rather than being on the more preventative or proactive side of things. And I did have a statistic on here for people who do tell me, it's fine. I only get, about 5-6 hours of sleep a night, but I'm fine. Sleep deprivation has been shown in studies to reduce insulin sensitivity by 20 to 30%, which is huge. So being insulin sensitive means your body uses insulin correctly. It uses it well to lower the glucose in our blood. That's what we really want to have. So, okay, with all that said, hopefully I'm not scaring anybody away. It's just to kind of reiterate, there are these common topics that, they come up in health often, and that's okay. I am here to tell you it's okay. It's just now we're going to figure out what we can do to make things better. I don't believe in, huge behavior change right away. Like I said, it does take a while for things to kind of turn around for the better. That's why we only take one or two things, at a time. So what does it look like in an actual session with a dietitian? So I've talked about maybe like some of the topics that can come up, the health topics. When you come in, for example, when someone comes in to work with me, I love, 60 minutes is great. It usually is not long enough, but 60 minutes is a good start. And so what happens during that time is I like to get to know you. Like, who are you? We're more than what we just eat, right? I like to know who you are. What are your hobbies? What are you all about? What are your interests and preferences? And what brings you joy in life? I think that's always important to know. I'm also going to look at what are your current and past diagnoses? What medications and supplements are you on? What's your stress load like? What's your energy level like? We are going to talk about anything GI related, whether it's nausea or you bloat after meals, or, hey, there's something going on with my poop and I got to talk about it because I don't know what's going on here. All the things we are going to talk about. Sleep and stress, as I mentioned, any kind of exercise. How often are you walking? What does that look like for you? I like to know the details, right? The devil's in the details. It's so true. So on that note, my goal is not to tell you how to eat. I am asked, hey, can I have a meal plan? And by all means, I will happily tell you what to eat. I will tell you what to do and what time to wake up and all the things. I would rather empower you with the knowledge. I want you to have the information so you make the decision to make it your choice. right? When things come from within, we are more likely to do it. When things fit better into our schedule rather than having someone bark orders at you, it's probably going to work out better for you. So I want to help you feel really confident and feel really good in the changes that we decide that we're going to do together. It's not up to me, but it's going to be up to you. So that's the part of nutrition that is underestimated more often than I wish. So health outcomes are driven by our habits, our routines, beliefs around food, the way that we talk to ourselves, and how consistent we are, right? So sometimes people will make a very drastic change, but it's very short-lived. And my question to that is, what are you hoping to have as a result? What are you hoping to achieve? So I'm looking at the behavior part. I'm looking at mental part, right? Are you criticizing yourself? Are you judging yourself? Are you putting yourself down? Or are you actually recognizing the efforts you're putting forward? Are you recognizing even the teeny tiny wins? Hey, I drove by, X restaurant today and I didn't go in. I chose, you know what? I'm going to go home and make that meal I was planning on making. Or, holy cow, I drank my 2 liters of water today. I did it. I want you to think about that part, celebrating those wins, because believe it or not, it actually impacts your thinking moving forward. So I am constantly evaluating all of that because that absolutely drives behavior and drives the goals that we set and the changes that we want to accomplish. Keeping my eyeball on the time. And I wanted to also point out another topic that usually comes up. Well, actually, I think always comes up is dietary supplements. Now, I know I could talk about this for an hour. I'm sure we don't have another hour. But I will say that dietary supplements 100% have their place, right? Medications have their place. With supplements, if I could only say one thing today, it would be they do not ever replace the fundamentals: nutrition, exercise, sleep, and stress. Taking one supplement does not replace one of those factors. So please keep that in mind. Also, thinking about how if a friend of yours, and I totally understand this, but when a friend of yours is taking a certain supplement and they say, wow, I feel good, or this is working for me, remember, truly, our bodies are all different. Our physiology is all different. So our bodies respond differently. They might need different supplements, that sort of thing. I will say, this is why I absolutely believe in drawing certain labs before you start supplementing, okay? There are such things as too much of something. Because, for example, if we take way too much zinc is a very popular one, right? Especially during winter when people, aren't feeling well and they want to boost immune function. We think the more the merrier with zinc. Well, the problem with that is that it says, sorry, copper, I'm taking over. And because zinc and copper compete for the same receptor sites. And so that becomes a problem. There's a lot of vitamins, there's a lot of minerals that compete for that. So we have to always look at balance and making sure we're not taking too much of something, right? There's a lot of rules and guidelines, I would say, when it comes to supplements, but just primarily keeping in mind that the more the merrier does not apply here. And whatever works for Sally Sue next door does not mean it's going to work for you. So this is the part where I would really encourage labs to be drawn and speaking with your health practitioner, truly. There was one supplement that came up, which was NAC, that's N-acetylcysteine. And so that that guy helps produce glutathione. So glutathione is like our master antioxidant. He's kind of a big deal. And so I was asked about NAC as a supplement. And I said, my first question was, talk to me about your exercise. That's where we're going to get mitochondrial improvement. That's where we're going to hit a whole bunch of other factors going on, rather than just NAC going down one pathway, where exercise hits multiple different pathways in our body. And I always think, well, if I could, what's more bang for your buck? It's going to be the exercise, right? It's kind of like the same idea. Magnesium is my other example. So oftentimes people will try, and I am one of these people also that encourages the incorporation of magnesium if we're looking to have some support with sleep, right? We want to support our sleep. So magnesium, it supports muscle relaxation, nervous system relaxation, all that good stuff. And so we think, okay, well, let's get some magnesium going, right? And if I'm not doing my job, if I don't ask you, what does your sleep routine look like? Are you scrolling on your phone at night? What is your sleep hygiene like? What is your environment that supports sleep? There's all these things I'm thinking of. So if I'm not asking you about that and I'm saying, oh, just go try magnesium, we'll just see what happens, then I am not being a good dietitian. And so that's why I'm saying taking magnesium won't replace all the other things, right? We want to make sure a supplement supplements. It helps along with all these other things, making sure we have a dark, cool, quiet environment, making sure we aren't watching TV right up until bed or falling asleep in front of the TV, making sure we have all these other things in place first before we throw all our eggs in one basket with one supplement. The last one I will just say for now is that, the omega-3 supplements, the fish oil. I mean, that's really taken off in the last, I don't know how long. So fish oil can be amazing. Again, with supplements, quality absolutely matters. And knowing what to look for also matters. So for example, and I talk about this a lot, you will see, and I want you guys to take a look at this. If you go to, I'm just going to say Costco, a lot of people buy their supplements at Costco. You go to Costco and you see, fish oil or omegas or whatever it says on the front. It's got 1,500 milligrams of ALA or 1,500 milligrams of fish oil. I mean, that sounds great, right? Oh, yeah, and it only costs this much, and I'm going to get all this fish oil. I'm going to be healthy and keep the inflammation down. And then you bring in the label, and I go, well, how much EPA does it have? How much DHA does it have? Ooh, that's not a lot because, and they go, well, wait a minute. Well, what about the front? And I go, those marketing people do a great job because 1,500 milligrams sounds like a lot, but the form in which it's in, the body doesn't convert it really well. There's a very low conversion rate. So that's why I look at these other components. So we want to know what we're looking for. We want to know why we're taking what we're taking. And is there anything else we could be doing and not thinking, oh, the fish oil is going to cure my inflammation. The turmeric is going to clear up all the inflammation. That's not how that works. It's part of it. I fully believe in turmeric. I think it's great, but it's a part of the puzzle. And so again, going back to the fundamentals, diet, sleep, exercise, and stress, what do those all look like so we can help keep that inflammation down? If you're consuming a high refined carbohydrate diet with lots of added sugar, low protein, low healthy fats, but we're relying on turmeric and fish oil to do their job and keep that systemic inflammation down, it might not work. So this is the part where, hey, let's talk about it. What are some minor changes that we can make in the diet? Maybe there's a better quality fish oil I can get you on. So all of it can work together. I'm really glad that, I was asked to do this podcast and talk about what a dietitian does, what their background is. I think it's really important to pay attention to the sources from which you get your information. So I understand social media can be fabulous and harmful at the same time. So always pay attention to what is being said to you, who is saying it, what is their background. Because if someone looks good and we're taking their advice based on their appearance, I want you to pause and just double check yourself. I want you to think, okay, what is going on here? What is it that you want, right? I like to know, and that's one thing I forgot to mention, is that like during these initial sessions I have with people, I want to know what your health goals are. What are you looking to achieve? You might say weight loss. Fine. What's that going to get you? What is that going to feel like? What will that mean to you if you reach that number on the scale, or you start to build muscles, or your waist circumference shrinks? What does that mean to you, right? So I want to know that stuff. So I guess I'm going to go ahead and wrap this up, you guys, because I could just keep talking and, there we go. So if you want to keep talking, you should book a session with me. Call PPMA's office and book a 60-minute initial session with me. We can talk about your health goals. If you only want to talk about dietary supplementation, we can talk about that. Specific questions, general questions, and no question is insignificant. Whatever is important to you is important to me. And so if I can help you on your health journey, sign me up. I am here for it. I do ask that when people come into the office, try to keep an open mind, right? It is very easy to fall back on habits that we've all created and maintained for decades. And so I promise you, I have your best interest in mind when I'm suggesting things. And so I like to work as a team. I like communication being a two-way street and figuring out, what feels good for you, what's going to help you get to where you need to be. So I hope you consider calling PPMA, making an appointment with me, letting me be part of that. And I'm happy to answer any questions that you have. Again, 60 minutes is never long enough. That's why we have follow-ups. That's why accountability is involved in there too. So I hope to hear from you all soon. Thank you for tuning in. Thank you for following Nourish MD podcast. And hope you all have a wonderful National Nutrition Month. All right. Take care. Bye.
Thank you for joining us for today's episode of Nourish MD, Dr. Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.